Hi, my name is Michelle Gelf, and I will be doing my presentation on stroke. First, I just wanted to go over what the common terms are for stroke and what the explanation is. A stroke or brain attack happens when a blood clot blocks the blood flow in a vessel or artery, or when a blood vessel breaks in the brain. This causes brain cells to die during the stroke, which abilities controlled by the area of the brain that was attacked are lost. Abilities like this include speech, movement, and memory. How a stroke patient is affected depends on where the stroke occurs in the brain and how much of the brain is actually damaged. Second, I wanted to go over the history of a stroke. About 2,400 years ago, Hippocrates, the father of medicine, first recognized stroke. At this time, stroke was called apoplexy, which means struck down by violence in Greek. This was due to the fact that a person developed sudden paralysis and change in well-being. No one really had any idea what was going on, not until about the mid-1600s, where Jacob Wepfer found that the patients who died with apoplexy had bleeding in the brain, and he also discovered that the blockage in one of the brain's blood vessels could cause apoplexy. Medical science continued to study all these cases and symptoms and treatments, and finally in 1928, apoplexy was divided into categories based on the cause of blood vessel problems. This led to terms of stroke and cerebral vascular accident. It's stroke and brain attack are actually now common terms for it, just meaning lack of blood supply to the brain, which is like a heart attack, where caused by a lack of blood supply to the heart. The term brain attack also conveys a more urgent call for immediate action and emergency treatment by the general public. Now, there are two types of strokes. The first one is the ischemic, which is a blood clot that blocks or plugs a blood vessel in the brain. Limited treatments are for this. Limited treatments might include TPA or clot buster, I'll go more into that later, or surgical removal of the clot, but this has to be within a 2 to 3 hour time window. Ischemic strokes are the more common ones. 83% of strokes are ischemic, and ages 45 to 64 years of age, only 8% to 12% result in death within 30 days. Now, the second kind of stroke is a hemorrhagic stroke. This is when the blood vessel in the brain breaks or ruptures. The current rate of this is about 17%, so it's a lot less common than the ischemic one. Among people 45 to 64 years of age, approximately 37 to 38 result in death within 30 days. This is a lot higher number of deaths. This is also because we do not have as many treatments for the hemorrhagic stroke. Another fact is that for children, approximately half of the incident childhood strokes are hemorrhagic. Despite current treatment, 1 of 10 children with a stroke will have a reoccurrence within 5 years. They are currently looking for treatments for the childhood ones. Now, symptoms of a stroke are really easy to remember. All you have to do is remember the acronym FAST. F, face drooping. A, arm weakness. S, speech difficulty. And T, time to call 911. When in doubt, call 911. They will not, you just have to know your body and the symptoms of which is happening to you. Other symptoms for the stroke could be sudden numbness or weakness of the leg, arm, or face, sudden confusion or trouble understanding what is going on around you, sudden trouble seeing in one or both eyes, and sudden trouble walking, dizziness, loss of balance, or coordination. And last one would also be sudden severe headache with no known cause. If any of these come about, best thing to do is to call 911. This is a little figure of just different things of when to call 911. This is just an ad. Treatments include the Thrombolix drug. Thrombolix it helps reestablish blood flow to the brain by dissolving the clots, which are blocking the flow of blood. In June 1996, the clot buster Activase, the actual thing is called Activase, became the first acute ischemic stroke treatment to be approved by the FDA. This was a huge step towards treatment for strokes. Activase is also known as a tissue plasminogen activator. To be effective, though, the thrombolytic therapy should be given as quickly as possible. A second one is the TPA, which I mentioned earlier. This is an enzyme found naturally in the body that converts or activates plasminogen into another enzyme to dissolve a blood clot. It may also be used in an IV by doctors to speed up the dissolving of the clot. This really needs to be given as soon as possible, preferably within 3 hours of symptom onset. It's also important that you know the stroke warning signs so you can get to the hospital and receive this. The results of a five-year trial conducted by the National Institute of Neurological Disorders and Stroke found that carefully selected stroke patients who received Activase within 3 hours of beginning of stroke symptoms were at least 33% more likely to survive than patients that were given a placebo or did not receive the TPA. TPA is not everyone is eligible for it, and not everybody is capable of using it. If that is the case, there is a third option, and that is the Mercy retrieval system. In 2004, the FDA cleared this innovative treatment where patients who had failed IV TPA or did not respond to it could do this. The system can be used for patients who are beyond the 3-hour time window and they have none of the drugs are being responsive. This device offers physicians and patients long-awaited options for stroke intervention and creates a departure for the historic method of caring for stroke patients. It has been reportedly proven to restore blood flow to the larger vessels of the brain by removing blood clots. However, this is a more new system of doing things. Only over 8,000 patients worldwide have undergone this procedure, but it has been performed at over 300 U.S. hospitals. The system is the use of a tiny corkscrew-shaped device that works by wrapping around the clot and trapping it. The clot is then retrieved and removed from the body. Now, the last form of treatment is the Penumbra system. This one is very new. In the beginning of 2008, it was announced that it was now available. This system allows for a safe revascularization of clotted vessels over an ischemic stroke, so this does not work for the hemorrhagic stroke. The system also helps restore brain blood flow, but using suction to grab blood clots in the brain for treatment of acute ischemic stroke. This system is revolutionary. Doctors had limited treatment options with acute ischemic strokes if patients were beyond the 3-hour window. So this allows for more time for the patient to get to the hospital within about an 8-hour window of symptom onset. Now, a recent article came out at the Journal of American Heart Association called Stroke, and it's the scientist who ran the study was Søren Paske Johnsen of Aarhus University in Denmark. And what the study was that he had 65,000 Danes live with a disease called arterial fibrillation, and he found that when he gave these patients an anticoagulant medicine that they actually reduced the risk of death and brain damage if a stroke occurred, which is a very common side effect for arterial fibrillation. It shows that the risk of suffering and serious brain damage or death due to thrombosis in the brain is significantly smaller for the patients with arterial fibrillation who received the medicine compared to those who did not receive the medicine. Only 22% of patients were undergoing relevant treatment with anticoagulant medicine when they were admitted with a stroke. So this is also saying that they have a protective effect of a medicine, and it is of course important to be particularly aware of patients who could benefit from treatment of anticoagulant medicine. This is Johnson speaking, and he also said how treatment with anticoagulant medicine balances on a bit of a razor's edge, as we know that it helps a large group of patients, but at the same time it can give side effects. So there is a downside to this, but it is a very new study. It just actually came out on the 10th of January, so it is very interesting. The study had 11,356 Danes with arterial fibrillation, and they were admitted to a hospital during the period of 2003 to 2009 after suffering a stroke. This is the largest study of its kind, which kind of caught my attention for the article. Some facts at the end of the article: 65,000 people today live with arterial fibrillation, which is one of the most common types of heart disease, which means that all those people are at risk of having a stroke. So the fact that they have found a treatment kind of for it is remarkable. Here's just a few number facts for strokes. U.S. has one of the highest rates of stroke attacks on citizens. Every 40 seconds, someone in the US has a stroke, and every 4 minutes, someone dies of a stroke. Some of the ways to prevent these is to know your body, basically. Know your blood pressure, know your cholesterol levels. Take care of yourself. Don't smoke. Don't abuse alcohol. Have regular doctor visits. Know what's going on. Make sure everything's healthy and that you are lowered risk of having a stroke. That's my presentation. Thank you for listening, and have a good day.